Thank you for joining us. My name is Nancy Miller and I'm the Director of Education and Research here at the Vitality Institute, the makers of the VI Peel. Today, we are going to be applying the VI Peel Purify with Precision Plus and talking about how to select the most appropriate patient for this peel, how to apply the peel, plus how to review the aftercare with your patient. The VI Peel Purify with Precision Plus brings in some really key ingredients. We're taking the beauty of Purify, the benzoyl peroxide, the kojic acid, the hydrocortisone, and now we're going to add in the lighten and brighten boosters. So now we're going to add in hydrocortisone, hydroquinone, and kojic acid. The VI Peel Purify with Precision Plus is for your patient who has an oilier skin tone but is also prone to hyperpigmentation. These can be your patients who have active acne plus PIH, or they have more sebaceous skin and are prone to issues of hyperpigmentation like PIH, acne scarring, and even PIE. Patients who would most fit this peel would be your patients of darker Fitzpatricks, your 4s, 5s, and 6s, African American heritage, who tend to produce more oil but are also more prone to the post-inflammatory hyperpigmentation. The VI Peel Purify with Precision Plus kit comes with several components that you will need to perform for your in-office treatment, plus what your patient will need in their aftercare. The patient aftercare kit is bundled like this, and we will review the aftercare kit as soon as we complete our peel on Erica. The in-office kit consists of an applicator cup, a 5 ml of your VI Peel Purify formula, a dual booster of our Lighten and Brighten Precision Plus formula, the VI Peel Prep towelette, and a 2x2 woven gauze. So Erica is with us today to receive her Purify with Precision Plus, and at this time Erica is battling a little bit of change with her skin. She's got an increased amount of oil production and she's got some breakouts. And for Erica, whenever she gets a breakout, it will leave that memory and she will develop a little bit of PIH as a residual to it. So Purify with Precision Plus today is going to help even out her sebum production, of course exfoliate her skin, but also control some of the new breakouts that she is experiencing. Acetone is the preferred degreasing method at this point because not only does it remove the surface oils, it also begins the dehydration process of the cells. And we know that the acids will penetrate better in both of those situations. The towelettes, like I mentioned, you can resaturate because within this little paquette is enough solution to resaturate your gauze and go back and thoroughly degrease the skin. When you degrease the skin, you want to see a matte hue to the skin. You don't want any sheen left. And as we know, oil tends to be overproduced for most people in the T-zone. So please make sure you get the nose and the forehead very thorough and relax. Thank you. So our patient is now prepped, and what we're going to do is prep our peel solution. When you open the VI Peel Purify vial, there's a little flip cap that you'll remove. You're going to lift the cap and using your non-dominant hand, apply your thumb to the rubber stopper on top and push against that stopper. This is going to apply counter pressure as the VI Peel vials are kept under pressure. You're going to lift this little handle up, roll it down, and remove the collar. Again, counter pressure is continuously applied. When you're ready to release the cap, just make sure you're away from your patient's face, and sometimes it pops, which is amazing. Go ahead and pour it into the applicator cup. All VI Peels are under pressure. The amount of pressure does vary. So we've got our core VI Peel Purify solution in the vial. What we're going to do now is add in our Lighten and Brighten boosters. Our Lighten booster is what's bringing in the hydroquinone kojic acid. And our Brighten booster is bringing in more salicylic acid. Now to open the booster, there's a little tab here. Basically you squeeze, break the membrane, and release the product into the applicator cup. You'll perform the same thing with the second booster. Squeeze on the little point, break the membrane, and squeeze that into the applicator cup. Give it a little stir, and you're ready to apply. To apply the VI Peel Purify with Precision Plus, you're going to use the 2x2 gauze provided. You're going to take your gauze and fold it in half or fold it in fourths. It's up to you, whichever way you feel you're able to control the application the best. For me, I like to fold it in half between my forefinger and thumb. Then you're going to go ahead and saturate your gauze. You're going to place the gauze in there and you're going to see the solution wick right up. You want to make sure that the solution is not dripping off your gauze, or you do not have control of where you're placing the chemical peel. You want to apply a little pressure to that applicator cup, and your gauze should be saturated but not dripping. So now we're ready to apply Purify with Precision Plus to Erica. We're of course going to apply to the most resilient areas of the face first, which is her forehead and cheeks. And then we will work our way to the less resilient or more sensitive areas like the nose, the upper lip, and the chin. When we apply the VI Peel, we're going to start on her forehead and using a medium pressure, sweep across the entire forehead. You can overlap slightly, maybe a 20 to 30% overlap. Her forehead is now complete. We'll come down the temple just a little bit and continue onto her cheek. For cheek application, you want to avoid the nostrils and nasolabial area. We're going to work on her cheek next, starting from the inner to the outer aspect. And again, you're applying with a medium pressure, slight overlap, and right along her jawline. We're going to take it to the left side and very similarly, medium pressure, come up her cheek and finish at her temple. Now that our gauze is slightly less saturated, we can do the nose, the upper lip, and the chin area. So we're going to sweep down her nose, her upper lip, and her chin. Okay, so this is our first layer. In between each layer, we have 3 areas we want to assess. First, patient pain tolerance. Second, skin tolerance and skin response. And the last thing is product penetration. So, Erica, tell me, how did that first layer feel on a pain scale of 1 to 10?
2.
2. Perfect. Great. And I'm looking for her skin response. Her skin is absorbing the product quite well. Slight bit of flushing that we can see. Nothing major, nothing significant, which is perfect. Once you've completed your assessment and the product has penetrated, you can go ahead and resaturate your gauze and prepare for the second layer. So we're again going to just saturate our gauze, squeeze out the excess, and begin on the forehead again. So we can sweep the entire forehead. This time we're going to apply a slightly firmer pressure. We're going to apply a medium to medium firm pressure. The easiest way to determine this is by how much the skin gives under your hand, right? So when you're applying something very gently or very lightly to your patient's skin, their skin does not move, right? Versus applying to this degree, you will see movement in the muscle and in the tissue under your fingertips. Okay, so this is our second pass, and you can relax. So I'll show you a quick pressure tip. I'll have you turn this way, Erica, real quick. So a light pressure is basically anything that does not move the tissue underneath your fingertips. Also something in terms of if you were to apply with a fan brush, you would get that similar mechanism going on. A medium pressure, you will see the skin give under your pressure. A firmer pressure, you will start to see greater give from the patient's muscle, tissue, and skin. Thank you. Okay, so how was that second pass? Pain level for you?
About a 2.
2, great. And so she is getting a little bit of flushing, so we're going to assess her skin response. We're going to make sure that the solution is penetrating before we proceed to the next pass. So we're going to resaturate our gauze and move to our third pass. Your third pass, you can change your application pattern if you like. You can apply from the brow to the forehead, almost in a crosshatch pattern. And you can bring it down vertically from the zygomatic arch down to the cheek and the neck. Again, from the temple down. Making sure you're retaining your pressure, right? The pressure is truly the driver to get that best outcome for your patient. All VI peels were created to be papillary dermal peels, right? They're created to penetrate to the dermis. So that was pass 3, and we're going to go back and do our 3 key assessments. Erica, could you tell me your pain level?
Still at about a 2.
Still at a 2, great. Her skin response is looking wonderful. Product is penetrating very well and very evenly. After each application, you will notice pain level slightly elevate for your patient. So it's kind of a bell curve, right? And this happens in less than 60 seconds. What will happen is the patient's pain level will start to raise over about 30 to 60 seconds, and then all of a sudden it starts to come back down. And that's due in part to the phenol that is in this blended peel. Phenol, we know, is an amazing exfoliating ingredient, has been around for hundreds of years, but it also has that anesthetic quality that really makes the VI peel portfolio so tolerable. So Erica, if I were to ask you now on your pain level, how does it feel?
I don't feel anything anymore.
Right. So again, that's been about 30 to 60 seconds of time, and you will see that, that pain level come back to a 0. We're going to go ahead and proceed with our 4th pass. Again, we're going to do a horizontal sweep, medium to medium firm pressure. We're going to listen to our patient's skin, observe their response, and maintain pressure. Okay, now that we've completed the periphery, we can work our way down to the nose, upper lip, and chin. Okay. All right, so we've just completed our 4th pass. Erica's doing well. Basically, at this point, we've got 1 layer left. Your goal with any VI peel is to use the full dose provided. So typically that's anywhere between 4 to 6 layers. All of the VI peels are applied in layers, and that layer indicates the depth that you're achieving. So if you're doing too few layers, you're not guaranteeing even distribution of the acids into the dermis. You're also risking possibly over-treating the skin too quickly, where you're not able to assess the patient's skin respond between those layers. Sorry, Erica. Okay. All right. I'm going to skip Erica's upper lip this time, just because it got a little bit spicy for her on that last pass. And she doesn't really have any issues on her upper lip. Okay. So we're going to allow just another 30 to 60 seconds for the product to penetrate and assess her response. So again, at this point, she's going to get that little heat spike. So how do you feel right now?
A 4.
A 4. Okay, great. And so as we continue to assess her skin, we'll probably see over another 30, 60 seconds, it start to minimize. So as you look at your patient's skin, you want to make sure that all of the product has penetrated. So we've just completed Erica's VI Peel Purify with Precision Plus. And now we're going to review her aftercare. And nothing will go on their skin for the first 4 hours following this peel. No moisturizers, no sunscreens. And the key reason behind this is that the acids in the Purify with Precision Plus can continue working for up to 4 hours. And we want our patients to reap the full benefit of those acids and that functionality on their skin. At the 4-hour mark, your patient will start a small routine of using post-peel towelettes. Now, these post-peel towelettes are an extension of the service that you just provided in office. You applied amazing peel to them in office, and what they are going to do are use these towelettes to continue to stimulate and enhance the skin. I always tell my patients that these are not refreshing towelettes. These towelettes have more acid in them. And in Purify with Precision Plus, these towelettes are geared at not only the exfoliation component, but also the pigment suppressing component, where they do get more hydroquinone and kojic acid, and they do get more benzoyl peroxide and retinoic acid to control their breakouts and control the sebum production. At the 4-hour mark, after your patient's peel, what you're gonna have them do is a cool water cleanse. We wanna cleanse the skin, fingertips only. We're gonna pat dry, and then we're going to use our first Purify towelette. Now the patient is going to apply the Purify towelette everywhere that the VI Peel Purify with Precision Plus was applied, avoiding the lips and avoiding the eyes. After they use the towelette, they're going to wash their hands. Again, there's more acid in these towelettes. And for our patients who are darker Fitzpatrick 4, 5, or 6, they're going to apply a small amount of our post-treatment repair cream. The purpose of the post-treatment repair cream is to prevent inflammation and to keep the skin moisturized and soothed. This same day that you applied the VI Peel, the patient just did their 4-hour post-peel towelette. They're going to do one more round of towelettes on that day. An hour before bed, they're going to cleanse their skin with cool water and fingertips only, pat dry. They're going to follow with the VI Peel Purify with Precision Plus towelette. And this is the towelette that's really focused on the PIH and the hyperpigmentation. Here's where the hydroquinone and kojic acid comes into play. So they're going to apply the Precision Plus towelette, just as they did the previous towelette. Allow it to penetrate 20 to 30 minutes. And then they're going to follow with the Purify towelette. Every place that the VI Peel was applied, they're going to apply the Purify towelette. They're going to wait 10 to 15 minutes for darker Fitzpatricks and apply another light layer of the post-treatment repair cream. Tomorrow morning, your patient is going to wake up, they're going to cleanse their skin, they're going to apply a little bit of the post-treatment repair cream, and they're going to use sunscreen. I always tell my patients, keep these guys in your bag, reapply as needed. If you're going to be outdoors, just make sure, like 2 hours like clockwork, you're applying your sunscreen. If you feel dry or itchy, feel free to apply the post-treatment repair cream. Tomorrow night, about an hour before bed, they're going to do one last round of towelettes. They're going to cleanse their skin, again, cool water, fingertips only, no washcloths, no Clarisonics at this time, just fingertips. They're going to apply a second Precision Plus towelette everywhere the peel was applied, avoiding the eyes and the lips. They're going to allow 20 to 30 minutes for those ingredients to penetrate, and then they're going to follow with the Purify towelette. And this will be their final Purify towelette, a total of 3. Again, allow that to penetrate 10 to 15 minutes. And then for our darker Fitzpatricks, again, they can follow with a light layer of the post-treatment repair cream. So we do provide our patients who receive the VI Peel Purify with Precision Plus a detailed aftercare. But we also have a secondary option for you. We have a VI Peel Aftercare app, which is the only app in the industry for any chemical peel. And really, for a company like Vitality Institute, who was created by a practitioner for a practitioner, the VI app is truly an extension of that, because yes, it is an app for our patients, where this app is amazing. It will send your patient push reminders. So at that 4-hour mark, when that first towelette is due, they will get a reminder. An hour before bed, they'll get another reminder. And the next night, they will get another reminder. But in addition, it has a huge FAQ section for the most common occurrences that patients may forget in terms of cleansing skin or applying sunscreen are all in the app, and they are there to support your patient and to support you, and ultimately assure your patient has that best result in the end.